Welcome back. Now we're going to go into a segment that is including medications for the eye, ear, nose, and throat. All of the sensory perception. You may have heard of the ENT doctor, and ENT stands for ears, nose, and throat. So we'll begin with some specifics on the conditions that are treated in this regard. Specifics in the treatment really are tied with a local effect. Generally, you are using something in the eye or the ear because you want it to act locally. You want it to be treated at the place that you are applying or instilling that medication. There's a variety of conditions that you could treat, and that could be an infection, whether it's an ear infection or an infection in the eye. Glaucoma, we know that's in the eye associated with elevated pressure. Allergies, sometimes you get watery eyes, or if you have sinus pressure or you feel very congested or stuffy, that's also something that you could use, not just in the eyes, but even in the nasal. Inflammation or pain. So those are some of the treatment specifics. Why don't we take a look at some of the medications? This slide has a variety of ophthalmic formulations or medications that we're going to use in the eye. Ophthalmic and ocular both indicate an eye formulation, a medication that goes into the eye. So be sure that you remember ophthalmic, ocular, or optical. Lumigan down to Zalatan are used for glaucoma. Lumigan is brand for bimatoprost. Travatan Z is travoprost, and that one is usually kept inside the refrigerator. Timoptic is Timolol. Alpha-Gan P is brimonidine, and Zalatan is latanoprost. Zalatan is also kept in the refrigerator. An interesting note on Zalatan is that it can cause a permanent darkening of the eye color. It also can lengthen or thicken the eyelashes. And that's an interesting topic because they've taken that drug and tweaked it a bit. And if you've ever heard of the drug Latisse, it's not the same exact generic, but it's very similar, and it's just used specifically for lengthening or thickening the eyelashes. Vigamox and Siloxane, you can kind of tell what those drugs are used for based on the generic names. Vigamox is moxifloxacin, and that is a quinolone antibiotic. Siloxane is ciprofloxacin. Again, that is a quinolone antibiotic. Those both are helpful in preventing or treating an infection in the eye. Patanol or Pataday or olopatadine, those are both used for allergies. They are, again, eye drops. FML, which is, it really is the name. You'll see that on the actual container of the eye drops, but FML stands for fluoromethylone, and that is a corticosteroid. It's used for inflammation. Nevanac is Nepafinac. Ocular is Ketorolac. Ocufen is flubuprofen. And all three of those medications are used for inflammation. A couple things to note I have also listed on the slide. It's kind of a complicated administration. You really have to be careful in how you administer the drops, ensuring that you are not touching the tip of the applicator directly to the eye, especially if there's an infection present, because you could run the risk of reinfecting yourself. It's also not uncommon for an individual to be on multiple eye drops. Just ensure that they're separating the drops by 10 to 15 minutes. The administration also, it requires you to be sure that your hands are clean. Because with eye formulations, we want to make sure that we are instilling something that's sterile. Sterile means there's no contaminants, no particulates, no microorganisms in it. It's just pure what it says it is. And so we want to ensure that it remains sterile. It's also helpful too that the formulation be isotonic, and that's to help minimize any complications or adverse effects when we're instilling it, which is why we only use eye drops for the eyes. It's very important that eardrops not be used in the eye. Side effects can include blurred vision. Occasionally you'll see the blurred vision, and that should go away. It's not something that remains for a long period of time. You might also have itching, burning, or stinging, and again, that should also not last long. 80% of a medication administered in the eye is going to be washed out. So obviously this is accounted for in the dosing or formulating drops, but you have to make sure that the patient is instilling it properly. And this isn't something that you would counsel on. I know I kind of say that without thinking specifically when I say you should. Really, I mean that it's good for the patient to know these counseling points. And this is where the pharmacist would get involved in teaching how to properly administer the eye drops. And generally, they pull down on the cheekbone, the higher cheekbone, so that you can form a pocket in the lower eyelid. And it's in that lower eyelid, the pocket in the lower eyelid, that they instill the drops in. Along with day supply, you want to commit to memory that you could get 15 drops per milliliter. And really, that's for both eye and ear formulation. Because the eye and ear drops come in different size containers, you also have to ensure that the patient is receiving enough medication for the entire duration or the entire regimen. Now we're going to move on to eardrops. Now this slide is the otic slide. Otic, we know, means ear. The first two drugs you see, Ciprodex and Floxin, are antibiotics. The Ciprodex not only has ciprofloxacin, but also dexamethasone. So that's a combination of an antibiotic and a steroid to help with reducing inflammation. Floxin, you can tell by the generic name, the floxacin, is also an antibiotic. So those are helpful in treating any infection in the ear. Cordyceps is a combination of 3 antibiotics. Well, 2 and then 1 steroid. Neomycin, polymyxin, and hydrocortisone. So the neomycin and the polymyxin are going to help to clear up any infection, while the hydrocortisone is helping with inflammation. Volsol HC is a combination of acetic acid used for drying, and hydrocortisone is going to help with inflammation again. Sometimes those are used for ear aches or ear pain. The Arlgan is another combination drop, antipyrine, benzocaine, and glycerin, helping with drying and more so for pain relief. Anytime you see cane in the generic name of a drug, it's safe to say that it's something used for pain. The bottom two, Dibrox and Cerumenex, are both over-the-counter products. They are useful in helping to soften earwax so that you can get it clean and removed out of the ear. Swimmer's ear is a literal brand name of a drop that is useful in swimmer's ear. It helps to dry the ear and getting water out of the ear. A note that you want to make sure that you remember is that ear drops will never go into the eyes. And I know I say that, you would think, well, doesn't that make sense? I mean, why would you mention that? But sometimes eye drops can be used in the ear. For whatever reason, the prescriber wants to use a particular antibiotic or what have you into the ear, but ear drops would never go into the eye just because of the formulation. It's just a much harsher drop, and we don't want that going directly into the eye. The treatment primarily for eardrops is going to be for infection, inflammation, wax buildup, or swimmer's ear needing to dry within the ear. Now let's move on to the nasal products. This is very commonly used for allergies or congestion. So these are nasal sprays. These are medication that's going directly into the nostrils. Rhinocort is budesonide. Nasonex and Nasacort is mometasone. Flonase is fluticasone. Beckinase is beclomethasone. Those four are steroids. They're helpful in reducing inflammation, thereby treating any congestion. Usually there's an inflammation associated with allergies. Astelin, the last one, is an interesting one. That is the only prescription antihistamine nasal spray. Ocean, Afrin, and the Neti Pot are over-the-counter products. Ocean is a brand name for just saline drops. Some cases people cannot use medication, so they are just only able to use saline, which is like a form of salt. It's just salt water. Afrin, the oxymetazoline, is a decongestant. You have to be cautious with that because with nasal decongestant sprays, you can only use from 2 to 3 days maximum. Otherwise, the congestion can return and it's even worse. The Neti Pot is a really interesting invention. Maybe some of you have used the Neti Pot before, but it's basically a saline rinse with tubing that goes into one nostril, up and around, so that the spray goes up and through, the saline water goes up and through the nostril and kind of just like rinses out the nostril cavity. A lot of people just really swear by it. They think it's a wonderful device. The only thing I would caution you on is make sure that you are using purified water. These medications, again, very useful in treating inflammation, allergies, or any form of congestion. I have a notate on here that to ensure that you are 100% sure of the dosage form. Because if you notice the names, the generic names, they can actually be found in other formulations. An example is the fluticasone. Fluticasone in itself can be found in a topical, something that you apply on the skin. It's also available as an inhaler, the Flovent. The Flonase, and I think of the NAS, nase for nasal, is a nasal spray. So you just want to ensure that you are sure and 100% positive on the specific dosage form that's to be filled. So let's move on. The next subject is going to be respiratory. In respiratory, you should think of the lungs and the exchange of oxygen for carbon dioxide within the lungs. We release carbon dioxide because we need oxygen to survive. Different conditions involved with the respiratory system can be treated with antihistamines, decongestants, antitussives, and be sure that you're aware of what these medications do. Antihistamines obviously block histamines. Histamines are associated with allergies or allergic reactions. Decongestants help to unclog things. They help to decongest the sinuses or the the lungs. Sometimes you have congestion like in the chest area, upper chest area, or in the sinus area. An antitussive is a medication that helps to relieve cough. An expectorant or mucolytic kind of go hand in hand. Those help to thin and break up any mucus. Bronchodilators help to dilate the bronchi or open up the airways. Corticosteroids help with inflammation. Inflammation is sometimes directly tied to a respiratory condition, which causes wheezing. It can cause trouble breathing. So the corticosteroids help to reduce that inflammation, thereby indirectly helping with breathing. The conditions I have listed include asthma. In asthma, just think of chronic airway inflammation, and that results in airflow obstruction. So symptoms are going to include wheezing, acute spasms, or times of where you lose your breath or have difficulty in breathing. Allergies can either be seasonal or allergies throughout the year, or allergies to specific things like pollen or maybe cats or what have you. Emphysema is a chronic airway obstruction that's due to the hyperinflation and lack of oxygen or decreased oxygen coming in. COPD is a disorder, and that is including emphysema and chronic bronchitis together. Now, those are going to be present together for at least 3 months a year for a 2-year consecutive span. Pneumonia is either bacterial or viral infection that causes fluid in the lungs. Now let's take a deeper look into some of the specific medications used for these disorders. Antihistamines. Atarax or Vistaril is brand for hydroxyzine. Phenergan is brand for promethazine. And promethazine can come either in an oral tablet or it's available as a suppository. What's interesting about the antihistamines is the older ones, the two that I mentioned here, although they cause a greater sedation or they're more likely to make you sleepy, they're very helpful in treating any nausea. Promethazine specifically can be helpful in treating nausea or if somebody is vomiting. So you can see how it would be hard to take something orally if they're very nauseous or vomiting. I know it's not the ideal route, but in some cases somebody might be really relieved by having a rectal suppository of promethazine. Claritin, Allegra, and Zyrtec are newer antihistamines. They should be less sedating than older ones, and they allow for decreased daily doses. Claritin is brand for loratadine, Allegra is brand for fexofenadine, and Zyrtec is brand for sertrazine. The Claritin, Allegra, and Zyrtec, they used to all be prescription only, and now they're all three available over the counter. Antihistamines can cause a drying effect, and the older ones especially can make you feel really sleepy. Decongestants, Sudafed, which is a brand for pseudoephedrine, help to decongest or help to unbreak any blockage or clogging that you might feel in the sinuses or in the chest, the lungs. Pseudoephedrine is regulated by the Combat Methamphetamine Epidemic Act, so be sure that you're familiar with that act, knowing that there's a daily restriction or a daily maximum that you could purchase as well as a monthly. The Sudafed PE is also a decongestant, only it's a different type of decongestant. It's phenylephrine, and these are medications you can buy without any restrictions it's not like you have to show an ID and sign for it and what have you like you do for the pseudoephedrine. That is over the counter and no questions asked about that. The antitussives, remember that's something that treats a cough. Not all cough suppressants are cough syrup. If you note the Tessalon, those are actually pearls and they're small round gel caps. Prescription only too. Tessalon is brand for benzonatate. Cherotocin AC or Robitussin AC is guaifenesin and codeine. That cough syrup is an exempt narcotic, and technically you could purchase that without a prescription if you can find a pharmacy that's willing to sell it to you. It's also listed as a controlled substance Schedule 5, and it's any syrup that does not contain more than 200 milligrams of codeine per 100 mLs or per 100 milligrams. Tussinex is a long-acting, another prescription cough syrup. It's one dose lasts for 12 hours. It's a combination of hydrocodone, which is an excellent cough suppressant, not just a pain reliever, but it also has chlorpheniramine and antihistamine. The hydrocodone definitely indicates a C3 controlled substance. So remember, not just because it's a cough syrup, but because it has hydrocodone, it is a controlled substance, and specifically Schedule 3. Delsum, the last one you see, is over-the-counter. It's the strongest over-the-counter cough suppressant, and it's a brand for dextromethorphan. Robitussin, DM, also has dextromethorphan. If you ever see products with DM, D like David, M like Mary, then that is representing or standing for dextromethorphan. Delsum is the strongest over-the-counter cough suppressant. I believe it has 30 milligrams of dextromethorphan per teaspoon. The Delsum is, I said it is over-the-counter. Cherotocin, remember, it's exempt narcotic. And the other two are prescription only. I mentioned the DM having dextromethorphan. If you see products with just the D, a capital D next to it, then that's indicating pseudoephedrine. You might see Sudafed is a decongestant, but you might see Claritin D or Allegra D or Zyrtec D. That means that it's going to have the antihistamine in addition to the pseudoephedrine. So know that the D represents pseudoephedrine, and know that the DM represents dextromethorphan. Let's keep going. Now this is the last slide for our respiratory agents. It's pretty busy, so just bear with me on this. The first segment, or the first area, the expectorant or mucolytics, will include Robitussin, which is a brand for guaifenesin, and Mucomist, which is prescription only, is a brand for acetylcysteine. They help to thin mucus, break up mucus, so that it's easier to get up and out. Now, what's interesting about the Mucomist is it's also used as an antidote for a Tylenol overdose. It can also be used for protective measures on certain diagnostic procedures. Acetylcysteine is a liquid. You might see it prescribed where the patient takes a certain amount, mixes it with juice or water, and taking it for preventative measures or for protection measures before a diagnostic procedure. The Tylenol antidote, the overdose for Tylenol, the antidote for a Tylenol overdose, it's only within a certain time frame too. So it's not like they could just, be a day after and they still use it. It does have to be within so many hours of the overdose. So it's not always used. It's not commonly used because usually an overdose is found afterwards or after the time frame that you're allowed to use the acetylcysteine. Atrovent is an anticholinergic, and the generic name is ipratropium. Can be used for asthma. Theodert is a brand for theophylline, and that's a very old medication. It's a xanthine derivative. It's very, very stimulating. It's very similarly structured to caffeine. So it's very, very stimulating. It can keep you up. It can make you shake. It can raise the heart rate, your blood pressure. It's not too often that the theophylline is used because there's alternatives that can be used. The bronchodilators are all considered fast-acting or rescue inhalers because they have a very quick-acting response. The Proventil, HFA, Ventolin, and ProAir are all brand names for albuterol. Albuterol is a bronchodilator, and they used to have inhalers, and sometimes you'll see it abbreviated MDI for meter dose inhaler, but they used to have them with CFCs, which help to propel the medication out because it's not good for you, number one, but secondly, the environment. They've changed these with the HFA. So HFA is an abbreviation for a really long name, but it's not an active drug. It's more of a propellant. It helps to propel the medication out. So now there are only brand names for the albuterol inhalers. They're more costly than what the generics used to be, but that has been quite some time since the older ones have been outdated or no longer made, really. Xopenex is very close to albuterol. It's levalbuterol, very closely related structurally, and Xopenex you might see with children or maybe in the elderly population. It's slightly tweaked, supposedly to help with minimal side effects or less than albuterol. Xopenex is not only available as a meter dose inhaler, but it's also available in respules for the nebulizer. And the nebulizer is a machine in which you have a solution and it gives off like a mist so that you can take in the medication. It should be quicker acting and no need for techniques or how to use an inhaler, because that can be a huge difficulty with techniques in using inhalers. I will mention that albuterol is available as a meter dose inhaler. It's available as a tablet, as an oral syrup, and as a solution for the nebulizer. Combivent has a combination of ipratropium and albuterol. So those can be used in asthma, they can be used in COPD. They definitely help with opening up the airways to help you breathe better. And if it comes down to it too, and let's just take an asthmatic, but what is going to keep an asthmatic from going into an asthma attack or keep them out of the ER and help to control or prevent any asthma attacks? It's not the bronchodilators, it's actually the corticosteroids. Bronchodilators are just meant for rescue inhalers. They're just meant for as needed, unless in some cases, if you have exercise-induced asthma, the patient may take a puff or two before they exercise. But the corticosteroids help on a daily basis, so that's not something that's PRN. The corticosteroids are used regularly. They are used every day, or they should be. They help reduce inflammation, thereby reducing the need even for the rescue inhalers or the bronchodilators. So you can tell if somebody is not controlled on their maintenance medication for asthma if they're going through several rescue inhalers or several bronchodilators in 1 month's time. The Advair is a combination of fluticasone and salmeterol. Asthmanex is mometasone. Ceravent is just the salmeterol. Flovent is fluticasone. And Qvar is beclomethasone. Now, with the corticosteroids, the patient should rinse their mouth out after each use, which helps to prevent thrush, an oral fungal infection. So bronchodilators versus corticosteroids, lots of information. HFA, definitely think of inhaler. The Robitussin is over the counter. And that's going to bring me to a conclusion here. I believe that's all that I had to share with this. This does end almost the last segment for pharmacology, just one more. Please contact me if you have any questions, if you need more of a thorough explanation. But I would focus on the roots of these drugs because I know there's quite a bit. Like the SONE, you can kind of see that. I'm just looking at the fluticasone, mometasone. You can kind of tell that those are steroids. So focus on the root words if you can't quite grasp all of the drug names. And we're just about finished. Thanks for staying tuned.